Hi everyone, Michael Sattler here for Advocate Advisors. We're a consulting practice that deals with the social determinants of health. And I'm here today to talk to you about the National SDOH Initiative Database, a program for which we're currently seeking support. We'll start off today by talking a little bit about the problem as we see it and then the solution that we have in mind. But let's start off by talking about social determinants of health. The healthcare industry has recognized for a while now that as much as 80% of the outcomes that affect people's health have nothing to do with the doctor or the hospital that they're engaged with. Things like your social circumstances, your behavior, your genetics, these can often have a more powerful impact on your ultimate health outcomes than whether you're interacting with a clinician. Now, many social determinants are systemic, like genetics or racism, and very hard to change. High-level policy and advocacy are critical to bring about meaningful change in health equity. But one tangible way to make headway along these lines right now is to deliver pragmatic interventions around addressable social determinants. If a patient comes into the doctor's office with a broken arm and happens to reveal that she's not sure where her next meal is coming from, the pragmatic intervention would be to connect her with someone who can get her fed. Now, a social initiative is defined as a network of organizations collaborating to deliver these interventions. They can include healthcare organizations, community-based organizations, municipal entities, usually enabled by some sort of technology platform. And it's a movement that's been picking up steam over the past several years. As a matter of fact, there are initiatives like this going on all over the country. Some are big, some are small, some are open, some are closed, but they're all delivering these pragmatic social interventions. But how they're actually bridging the gap between the healthcare industry and the community is a topic of interest to many. In fact, even more so in the face of the COVID pandemic and the recent calls for police reform. Figuring out how these organizations are collaborating within their communities could be of interest to our entire society. But unfortunately, there's no good data out there about them. How big they are, how many of them there are, where the gaps are, how well they're doing, how they're funded, what platforms they're using. You'll occasionally see references to an initiative in a research paper or a case study written up by an interested organization. And what that does is it makes it very difficult for us to learn about them, to collaborate with them, to learn how to avoid the mistakes that they've made and build on the successes that they've had. We think that's a problem that should be solved, and it should be solved quickly to support the widespread mainstream adoption of these kinds of initiatives. And that's what the National SDOH Initiative Database is designed to do. We envision it as a free, crowdsourced, web-accessible, public database of all SDOH initiatives in the US and Canada. The implementation would be pretty straightforward. We would promote the database to as many organizations as possible and encourage those initiatives to complete their own profiles using structured data to make the data information useful to the general public and to provide data sets for researchers and analysts and planners. Participation would include organizations that are delivering simple resource directories, referral networks, community information exchanges, and all varieties of other collaboration platforms that are out there today. To make this project successful, we're envisioning a governing board of 5 to 6 organizations, an operational team of 2 to 3 plus contractors during the build stage, but most importantly, a group of supporting programs that can provide their advice and support and interest in getting this out into the world and using the data that is collected as a result. Our goal is to implement quickly and get this database into the world as quickly as possible to support COVID and police reform efforts. And we think that's doable. This video is part of our effort to gather support, and planning for the technical side of it is already underway. We'd like to thank you for your time and attention. And if you, like us, believe that these kinds of collaboration networks are useful and important, we hope you'll agree that this database is a valuable first step in getting them propagated out into the mainstream. There's a link to the print version of this proposal in the comments to this video if you find that more useful. And if you or your organization would like to make this project happen, we'd like to ask you to step forward and volunteer to be a supporting partner at this time and contribute your energy and your effort. in order to make it occur. There's contact information at the end of the video. Again, I've been Michael Sattler from Advocate Advisors, and thanks again for your support.